Yeah, I went through college at the University of Chicago. So I went through 4 years college. I actually graduated a little bit early so I can do more research. I did research at the University of Chicago, where we did a lot of pancreatic islet transplants. We did the first living-related liver transplant there when I was in the lab, and I did a lot of animal surgery back then. And then I went to medical school at the University of Chicago, so that's another 4 years down there in the south side of Chicago. And then afterwards, you matriculate at the residency level. And I decided to go to the University of Michigan. I did spend 5 years there at the University of Michigan. And what's nice about the University of Michigan, we have no fellows. And so even as a resident, you get to do the most difficult cases. You have a high level of responsibility. And afterwards, I met my wife there, so we moved to a location that's halfway between. So St. Joe is a natural location for that. Now, when you have asymmetric swelling like this, does it hurt back here? Does it hurt back here? I always wanted to do something that made a significant change in someone's life. We all try to do that, but in a sense, that's not all medicine is. Sometimes, some parts of medicine, you manage things. And I always wanted to be very, effectuate a change. When somebody gets into an accident, when the ravages of arthritis get to a point where you really have a hard time dealing with normal things, going back to normal activities of daily living, returning to work, orthopedics really is one of the few things in medicine that can rapidly return you back to your previous level of function. This is a diamond in the rough. I really think that in terms of natural beauty, the fact that we live in an area where the patient population and the area that our practice can gain patients from, it just is such a positive place because, if you have a ton of different doctors in one area, it's just the level of competition is not necessarily a good thing. I feel like you can live and sleep well knowing that you give the most honest answers to people. You're not necessarily scrambling to do more operations. It allows you the flexibility of becoming somebody who doesn't always offer surgery, who can offer non-surgical interventions and still make a good living for ourselves. I used to work out at Orthopaedic, and Dr. Stagg, he practiced into his mid-90s. Oh my God, he took care of grandchildren and great-grandchildren. I was like, wow, that's got to be wonderful. And really, my idea of being a doctor comes back. I'm old enough to watch Marcus Welby, and the whole idea of being not a country doctor, but a doctor who practices in a small town and seeing multi-generations and working on your neighbors. You don't get that in Chicago necessarily. You don't get that in the bigger cities, so that's been a real positive thing.